Hello, my name is Vreca-Ponnequin, and I'm a board-certified family nurse practitioner. Today, we will talk with Craig Rush, a 71-year-old male that has been recently diagnosed with hereditary hemochromatosis. Mr. Rush's father, Augustus, had hemochromatosis, and his brother Dana is a carrier. Mr. Rush's father was not tested. There was no knowledge of hemochromatosis on his mother's side. However, Mr. Rush's mother was adopted. None of the third-generation offspring have been diagnosed with hemochromatosis yet, and patient is concerned about his adult children having the disease. Mr. Rush is an active private pilot and retired airplane mechanic. He is one half Portuguese and half melting pot American. His father is 100% Portuguese. Mr. Rush's wife is a teacher. Mr. Rush's three-generation pedigree was completed during a previous office visit. We will discuss Mr. Rush's pedigree, diagnosis, treatment, as well as answering any questions he may have. Hi, Craig, how you doing?
I'm doing fine. How are you?
Oh, I'm doing just fantastic. So I wanted to talk to you about your lab results, pedigree, and what they mean.
Okay.
How are you feeling today? Last visit, you told me you were feeling fatigued, weak, and had a decreased sex drive. Any abdominal pain or other symptoms?
Still feeling extremely tired, having mild abdominal pain. However, I do have some joint pain.
Okay. Well, let's take a look at your labs. The labs we drew included serum iron, serum transferrin, also known as TIBC or total iron binding capacity, serum ferritin, transferrin saturation, which is also known as TSAT. I also added a complete blood count and complete metabolic panel to get a complete overview.
Okay. May I have copies of the labs for my records?
Absolutely. I will have my medical assistant print them out for you.
Thank you.
Looking over your labs, I noticed that your ferritin and TSAT levels are elevated. This is indicative of hemochromatosis. There are other disorders that can present similarly to iron overload or hemochromatosis, like arthritis, lupus, and liver cancer.
I see. What does that mean?
Hereditary hemochromatosis is an inherited genetic mutation that causes increased absorption of iron from the diet, leading to iron overload. The iron accumulates and potentially causes organ damage, hormone system dysfunctions, diabetes, joint pain, fatigue, cardiac complications, hypogonadism or decreased libido, and skin discolorations if not treated.
I know my father had it. My brother had genetic testing done, and he's a carrier, but he doesn't have any symptoms.
Yes, it is inherited and caused by receiving a mutated gene from each parent. There are a few subtypes, all genetically recessive, which means non-dominant, except for one dominant type. Roughly about 90% of people with hereditary hemochromatosis do not have symptoms. When iron overload is detected, phlebotomy is the initial treatment. This can be done at the hospital or through the American Red Cross. Other supportive treatments include dietary changes, such as decreased intake of red meat and iron-rich foods, alcohol avoidance, and careful intake of vitamin C supplementation. If there are no symptoms or positive test results that indicate a mutation, then the genes are functioning normally and not allowing iron overload to occur. Looking at your pedigree, and considering you are European and of Portuguese origin, it may be likely that you have the most common mutation on the HFE gene. However, we cannot be certain until genetic testing is performed to determine which mutation you have. According to the pedigree, I see that your father had it, however, your mother was adopted, and her family history is not known. She has osteoporosis, which could potentially be caused by iron overload. There is a possibility she has a family history of hemochromatosis since your labs are showing positive indications. A recessive gene from each parent causes the disorder.
This is interesting and concerning to me, especially for my children. Is it fatal?
The disorder can cause damage to organs and other complications with increased iron overload status over time. However, we are performing the necessary tests so we can gain more information and baselines to develop an appropriate treatment plan for you and your family. Let me show you this diagram called the Punnett square. Okay. This shows inheritance patterns. It shows that if one parent has hemochromatosis, which is right here, and that would be you, there is a 50% chance of passing the disease to children during each pregnancy. This would be potentially your wife's genetic makeup. She doesn't have any symptoms or anything else. But when you put the two together, it does show that 50% of your children may end up having hereditary hemochromatosis, but they may not, or they may have symptoms.
Should my family, including my wife and children, all get tested? What type of testing is done? We're open-minded and feel comfortable with genetic testing.
Genetic testing for you should provide us with more information so we can determine the exact mutation. Important to note, however, is just because an individual may have 2 copies of the mutated gene does not mean that hereditary hemochromatosis will affect them. Genetic testing can be expensive, and initial testing are the labs we just resulted for you. If the labs are positive, as in your case, then genetic testing is the next step. Considering your family history, insurance may cover testing costs and provide additional information and peace of mind.
What's the next step? We're a close family and get together often. We will have opportunities to discuss findings of any testing with other family members.
The next step is making an informed decision on whether or not you wish to proceed with genetic testing for yourself and possibly your wife, so we can assess risk for your children. The results would reveal the mutation and if your wife may possibly be a carrier. Regardless of genetic test results, we should proceed with phlebotomy in your case. Another thing I would like to do is refer you to a genetic specialist so they can further assess you and your family's needs. I can order the initial labs and get the referral ordered while we wait for results.
You've been thorough, and I would like to proceed with genetic testing for myself. What tests would you order?
Initially, I would order the HFE screening test. This test would identify HFE variants, with the most common ones being C282Y, H63D, and S65C. If results are positive, we will go over results and determine where to go from there. Hopefully, by that time you will have an appointment with the genetic specialist that can assist you further. Do you have any other questions or concerns? I will have my medical assistant give you information to take home with you, as we discussed a lot today, as well as information on where to obtain labs. The referral will be sent out this week, and you should hear from the specialist in a few weeks. If you have any questions, please don't hesitate to contact us.
No questions. Thank you. Yes, I learned a lot today.
Let's follow up after genetics testing. I will have someone call you to make an appointment to discuss results.
Okay, thank you.
Great. We'll see you after you get your test results.
Okay, bye-bye.
Thanks, Craig. Bye-bye.